Welcome to the Health Bulletin. In Kratie, Cambodia, tragedy struck when a lethal strain of H5N1 bird flu claimed the life of a young boy and infected his older brother. Just 9-year-old boy succumbed to the virus on 8 February, and another brother, 16, infected with H5N1 strain of bird flu, already detected in UK too. The two boys were believed to have been infected with bird flu, also known as avian influenza, after eating a meal made from birds kept on their farm in Kratie, Cambodia. Avian flu occasionally jumps to humans, especially to those in close contact with poultry, and has a frightening death rate which can rise as high as 50%. Before we move forward, if you're finding this content helpful and informative, please consider hitting the subscribe button below and stay updated with our latest medical videos. As far as the Cambodia avian flu case is concerned, the boy's older brother, aged 16, has also been found to be infected with the H5N1 strain. Currently, the older boy is undergoing medical treatment, and officials are investigating who had contact with the brothers and how and where they contracted the virus. It added the boy who died last week fell ill with fever, followed with shortness of breath, coughing and fainting after eating a meal which his parents had cooked from chicken and ducks they raised. 4 deaths from bird flu were reported in Cambodia last year, and many people still prefer to buy live chickens at markets with many backyard farms. The WHO and the UN's Food and Agriculture Organization have raised concern over the Lunar New Year festivities, which is celebrated in much of Asia, poses a risk of spreading the virus. Last year it was reported a woman died after contracting H5N6, a rare form of bird flu, after following a visit to a live poultry market in Sichuan, Hong Kong. The 33-year-old first developed symptoms on October 22nd and was quickly taken to hospital, but she died on November 14th. As influenza viruses have a natural reservoir, in aquatic birds they are impossible to eradicate. The zoonotic threat remains elevated due to the spread of the viruses among birds. Whenever avian influenza viruses are circulating in poultry, there is a risk for sporadic infection and small clusters of human cases due to exposure to infected poultry or contaminated environments. Therefore, sporadic human cases are not unexpected. Zoonotic influenza infections will continue to occur. To minimize public health risk, quality surveillance in both animal and human populations, thorough investigation of every human infection, and risk-based pandemic planning are essential. Thank you for watching, and if you enjoyed this video, make sure to subscribe to our channel for all the latest in medical breakthroughs and health alerts.